What if I told you that one of the most dangerous blood pressure moments of your entire day may not happen when you wake up, and it may not happen at the doctor's office either? What if it happens after lunch, after dinner, after that healthy breakfast you barely think about, and almost nobody is warning seniors to watch for it? Because a lot of older adults are walking around convinced their blood pressure problem only means one thing: it runs too high. But the hidden truth is this: after meals, your pressure can swing in the wrong direction, your circulation can get thrown off, and the move many people choose right then, sitting still for too long, can actually make the whole thing worse. And that brings us to the question I want you thinking about through this entire video. What is your blood pressure doing after you eat? Not what it was 3 months ago at a clinic, not what the nurse wrote down while you were nervous and half awake. I mean, what is it doing in your real life, in your kitchen, after pancakes, after soup and crackers, after a restaurant lunch, after that heavy dinner that leaves you tired and foggy? Because if you are over 60, especially if you already have high blood pressure, diabetes, dizziness, fatigue, or you take medication for your heart, what happens after meals can quietly shape how steady, safe, and independent you stay. I'm Dr. Andrea Patrick, and for more than 20 years, I've cared for adults dealing with high blood pressure, low blood pressure, circulation issues, dizziness, falls, strokes, heart strain, and the kind of symptoms people normalize until something scary happens. And by the time many of them finally get help, the warning signs have been there for a long time. They just didn't know what they were looking at. So in this video, I'm going to show you the one simple move after meals that can help many seniors protect their blood pressure, why it works, who needs to be careful, and how to use it the right way so it actually helps instead of backfires. Now, let me say something that sounds contradictory, because it is. A lot of seniors are terrified that movement after eating will somehow be too much for them. And the safer choice is to sit down in the recliner, turn on the television, and let the food settle. But for many people, that exact habit is part of the problem. Not always, and not for every medical condition, but often enough that you need to know this. After a meal, your body has to redirect blood toward digestion. If your nervous system, blood vessels, and heart don't adjust well, your pressure can become unstable. That is why some people feel sleepy, weak, dizzy, headachy, flushed, or just plain off after they eat. And here's the part nobody explains clearly. When food enters your stomach and intestines, your digestive system asks for more blood flow. That is normal. Your body is supposed to compensate by tightening certain blood vessels and slightly adjusting heart function so your brain and the rest of your body still get what they need. But aging changes that response. Blood vessels may be stiffer. Hydration may be worse. Medication timing may interfere. Nerves that regulate pressure may not respond as sharply. Blood sugar may surge and crash. So instead of a smooth transition, you get turbulence. And in seniors, turbulence in blood pressure does not feel like a small thing. It can feel like your body betrays you. Some people experience this as a spike. They eat a salty, heavy restaurant-style meal, and their pressure trends upward over hours. Other people experience the opposite problem, which is especially sneaky in older adults. Their pressure drops too much after eating. And if you've never heard that before, that is exactly why this topic matters, because people assume every after-meal symptom means the food was too rich or they just got a little sleepy. No, sometimes what you are feeling is circulation instability. Sometimes it is your blood pressure reacting badly to the meal. And if you are getting dizzy after breakfast, lightheaded after lunch, or weak after dinner, your body may be telling you more than you think. I remember a patient who kept saying, "Doctor, every afternoon I feel strange, but only after I eat." He didn't call it dizziness exactly. He called it a wave. He said it felt like someone pulled the plug on his energy, And if he stood up too fast after lunch, he had to grab the counter. Everyone around him thought he was tired because he was getting older. He thought maybe it was just the big meal. But when we started looking closely, the pattern was obvious. After meals, his blood pressure control was poor. And once we changed a few habits, especially what he did in the minutes after eating, his afternoons became more stable, clearer, and safer. So what is the one simple move? It is not a miracle pill. It is not an expensive supplement. It is not lying down flat right after dinner. For many seniors, the simple move is a short, gentle walk after meals, used at the right time and at the right pace. Not a power workout, not a marathon around the block, not huffing and puffing until you regret it. I'm talking about an easy, steady, practical walk that helps your circulation do what it was supposed to do all along. And yes, for some people, this can make a surprisingly meaningful difference in those dangerous after-meal blood pressure swings, which is why I want you to understand the mechanism and not just the headline. Because the headline is never the whole truth, is it? When people hear something like, one move drops blood pressure by 48%, they imagine that everybody who shuffles to the mailbox after dinner will suddenly become a new person. And that is not how real medicine works. Bodies are different. Medications are different. Problems are different. What matters is that in older adults, post-meal walking has been shown to help blunt unhealthy after-meal blood pressure changes in certain situations. And walking as a habit improves blood pressure control more broadly over time, especially when it becomes part of daily life instead of a once-in-a-while rescue plan. And that is where the hidden truth comes in. The goal is not just to lower a number. The goal is to improve how your blood pressure behaves in real life. Does it stay steady when you stand? Does your brain stay well supplied after you eat? Do you feel safer walking to the bathroom? Can you think clearly after lunch? Can you finish the afternoon without crashing into a chair? Because a blood pressure number on paper is useful, yes, but function is everything. If your pressure is so unstable after meals that you feel wiped out, unsteady, or afraid to move, that instability is affecting your independence, whether you call it that or not. So let's talk about why walking helps. When you take a short, easy walk after a meal, your leg muscles begin acting like little pumps. They help move blood back toward the heart instead of letting it pool poorly in the wrong places. And that matters because circulation is not just about your heart pushing blood forward. It is also about the system returning blood efficiently. Light movement can also help with blood sugar handling after a meal, and that is important because large glucose swings can worsen how you feel, especially if you are older, insulin resistant, or tired to begin with. On top of that, walking can calm stress chemistry, improve vessel function, and reduce that heavy, stagnant feeling many people get after eating. But notice what I said, a short, easy walk. The villain here is not only inactivity, the villain is also doing the right thing the wrong way. If you finish a large dinner and immediately go out for a steep, fast, competitive walk trying to burn it off, that can feel awful for some people, especially seniors with joint pain, heart disease, reflux, or poor conditioning. This is not punishment walking. This is support your circulation walking. A stroll, hallway laps, 10 minutes around the house and driveway, maybe the grocery store aisle, maybe the senior center corridor, maybe the living room while the tea is cooling. It needs to feel sustainable, not dramatic, because dramatic rarely becomes a habit. The next villain is timing. Some people wait too long. They eat, sit for an hour, start feeling lousy, and then assume the moment passed. But in many seniors, the after-meal window is exactly when the problem is unfolding, and you want to support the body before you completely sink into that slump. That does not mean leaping up while you are still swallowing your last bite. It means finishing your meal, taking a brief pause, and then moving gently while your body is processing the meal. That small choice often separates people who stay clearer and steadier from people who get swallowed by that post-meal fog and then wonder why afternoons have become so hard. And let's name the villains one by one because I want you to see them. Villain number one is the oversized meal. One huge breakfast loaded with refined carbohydrates, salt, sugar, and fat can push your system into a much harder adjustment than a smaller, balanced meal, especially in older adults. Villain number two is dehydration. If you are starting the meal already a little dry, your circulation has less room to adapt. Villain number three is alcohol. Villain number four is sitting too long afterward. Villain number five is poor medication timing in some people. Villain number six is pretending fatigue, dizziness, and weakness after meals are just normal aging, because once you normalize a warning sign, you stop listening to it. Let me slow down on that last one because it matters. Aging changes many things, yes, but I always feel terrible after I eat is not a badge of wisdom. It is information, and older adults are too often taught to tolerate things they should investigate. If you routinely feel sleepy, clammy, shaky, faint, foggy, irritable, weak, or off balance after meals, pay attention. If you feel chest discomfort, shortness of breath, black spots in your vision, or like you might pass out, pay serious attention. And if symptoms are severe, sudden, or dangerous, that is not a YouTube problem. That is a call your doctor or seek care problem. Because no habit in the world should be used to ignore a red flag. Now, here is the central question again. What is your blood pressure doing after you eat? Because until you answer that, you are guessing, and guessing is how people stay stuck. I want you to become a respectful observer of your own body, especially if you are over 60. If you have a home blood pressure cuff, start checking patterns, not obsessively, not every 10 minutes all day long, but enough to learn. What is your pressure before breakfast? How do you feel 30 to 60 minutes after the meal? What about after lunch? What about the days you walk? What about the days you don't? The pattern will often teach you more than your memory does. You may discover that your morning meal is the troublemaker. Maybe breakfast is not harmless for you. Maybe it is orange juice, toast, jam, sweet coffee, and a fast insulin and circulation roller coaster before noon, and you keep blaming low energy on sleep. Or maybe lunch at the diner is the problem. Soup, sandwich, chips, pickle, dessert, and a long drive home where you feel oddly weak and sleepy. Or maybe dinner is when you overeat because you barely ate all day. Then you sit down and wonder why your legs feel heavy and your mind goes dim. These are not random moments. They are clues. And once you see the clues, you can start changing the script. So how do I want you to use the walk? Think gentle, regular, and almost boring. Boring is beautiful when it works. After a meal, give yourself a brief pause, then stand and walk at a conversational pace. If you can talk in short sentences comfortably, that is probably the right zone. And for many seniors, even 5 to 10 minutes is a meaningful start. If 10 minutes feels easy, good. Stay there or build gradually. If 5 minutes is all you can safely do, start there. The goal is not to impress anybody. The goal is to help your blood vessels, your muscles, your glucose handling, and your circulation ride the meal more smoothly, instead of collapsing into a chair and hoping for the best. And yes, there are people listening right now thinking, "Doctor, I can barely walk to the kitchen some days." I hear you. The principle still applies. Light movement is often better than freezing in place, but you must match it to your body. If hallway walking is too much, march gently in place while holding the counter. Do a few rounds around the dining table. Stand and shift weight from one foot to the other. Walk to the mailbox and back. Do seated marching if balance is truly a concern, and then stand for a minute or two with support. The point is to recruit the body, especially the legs, instead of letting the post-meal slump take over completely. Now, if this video is helping you already, take a quick second to like it and make sure you're subscribed because I make these videos to help people protect their independence before a preventable crisis changes everything. And if you're already part of this community, thank you. Truly. It means a lot to me that you show up here wanting to take your health seriously because that is how lives change. Not through one viral promise, but through understanding, repetition, and doing small things well enough and long enough that your body finally starts responding in your favor. Let's go deeper because the move alone is not the whole answer. If you walk after a meal, but the meal itself is working against you, you're making your job harder. One of the biggest drivers of after-meal trouble in seniors is the large carbohydrate-heavy meal, especially when it is refined. Pancakes, syrup, white toast, sweet cereal, pastries, big bowls of potatoes, oversized pasta, sugary drinks, dessert on top of a restaurant portion that was already too much. These meals ask your body to do a lot, fast. More digestive blood flow, bigger glucose swings, more sleepiness, sometimes more blood pressure instability. This is why the walk works best as part of a smarter after-meal strategy, not as an excuse to ignore the meal. So another hidden truth is this. For many seniors, the answer is not only move more, it is ask less chaos of your body at one time. Smaller meals can be easier on blood pressure than giant ones. Slower meals can be easier than rushed ones. Balanced meals with protein, fiber, and a more reasonable carbohydrate load can be easier than the classic American comfort plate that looks normal because everyone around you is doing it, but your blood vessels do not vote on tradition. They respond to physiology. And if your body keeps punishing you after meals, it may be because your meals are too large, too fast, too salty, too sugary, too dehydrating, or all of the above. And then you sit perfectly still on top of that. There is also the water issue, which people underestimate. Many older adults walk around mildly dehydrated all day and do not realize it, especially if they are on certain medications, avoid drinking because they dislike bathroom trips, or simply lose track. Then they eat, their circulation has to adjust, and they do not have much cushion. This is one reason some people feel dramatically better when hydration improves. Not because water is magical, but because blood pressure management is mechanical in part. Volume matters, circulation matters. If you are allowed fluids and not on a restriction, having a sensible amount of water earlier in the day and around meals may help your system handle that transition more gracefully than when you are running on empty. And now we need to talk about medication because this is where people get themselves into trouble by improvising. Some seniors watch a video, hear that after-meal symptoms can involve blood pressure, and immediately decide to skip or move their medication around. And that is not what I am telling you to do. Medication timing can matter for some people, yes, but that is a doctor conversation, especially if you have frequent dizziness, low readings, falls, diabetes, Parkinson's disease, kidney disease, or you are on multiple blood pressure medicines. The dangerous combination is symptoms plus guessing plus pride. If something is off after meals, measure, document, and bring the pattern to your clinician so the plan can be tailored to your body. Here is something else many people miss. The post-meal walk is not only about the few minutes after that meal. It is also training your body over time to behave differently. Walking as a regular habit improves blood pressure control more broadly. It helps with conditioning, blood vessel health, blood sugar, stress handling, and weight regulation, all of which affect blood pressure. So the move after meals is both immediate support and long game investment. Some people feel a quick difference in energy and steadiness. Others notice over weeks that their readings are improving, their afternoons are less brutal, and they are not as afraid of standing up after lunch. Both kinds of improvement matter because one protects you today and the other protects you later.
I also want to correct a common mistake. People assume the walk has to be outdoors to count. Absolutely not. If the weather is bad, if it is icy, if you live in an apartment, if the neighborhood feels unsafe, if your knees are unreliable, then do not romanticize the perfect walk and end up doing none, because none is what hurts you. Walk indoors, use your hallway, circle the kitchen island, walk the perimeter of the living room during commercials, pace gently while you rinse dishes. If you are in assisted living, walk the corridor with a friend or aide. What matters is the movement, the timing, and the consistency, not whether it looks impressive to somebody driving by. And please do not let pride ruin safety. If you use a cane, use it. If you need the walker, use the walker. If you need a family member beside you for a week while you test this habit, good. That is wisdom, not weakness. Because the point of this strategy is to reduce the chance that you feel faint and fall, not to prove you are stronger than your body. And if you already know that after meals are your vulnerable time, then build your routine around that truth. Clear the floor, wear proper shoes, do not rush stairs, do not bolt up, stand, orient, then move. Sometimes the most protective thing a senior can do is stop pretending they have the same buffer they had at 35. Let's bring the fear into the room for a second, because I think it motivates people when it's honest. What scares me for seniors is not just a blood pressure reading. It's the chain reaction. Big meal, pressure instability, dizziness, one bad turn, one reach for the chair that misses, one fall, one head injury, one hospital stay, then immobility, confusion, deconditioning, and suddenly life is not the same. And that sounds dramatic until you have seen it. I have, over and over. That is why these small habits are not small. A steady afternoon is not small. Avoiding one preventable fall is not small. Keeping the brain well perfused and the body confident after meals is not small. Because independence is usually lost in pieces before people realize they are losing it. And if you're wondering whether this only applies to frail seniors, no, it applies across a spectrum. Maybe you're 66 and active, but your lunch still wipes you out. Maybe you're 72 and on blood pressure medicine and didn't realize after-meal dizziness had a name. Maybe you are 80 and everybody keeps telling you to rest more when in reality, a little strategic movement helps more than another hour in the recliner. And maybe you are caring for a parent who always gets sleepy and weak after dinner, and you assumed that was just old age. Sometimes it is not old age. Sometimes it is a pattern worth interrupting. And the sooner you interrupt it, the more room you have to protect function. So let's make this extremely practical. If you want to test whether this helps you, give yourself a simple 1-week experiment. Choose one meal a day, ideally the meal after which you feel the worst, and for 7 days, eat roughly the same type of portion. Then do your gentle walk afterward. Track how you feel 20 minutes later, 60 minutes later, and if you have a monitor and your doctor says it is appropriate, check your blood pressure pattern as well. Then compare that with your usual days. Do you feel less heavy, less sleepy, less dizzy, more clear-headed, more steady on your feet? Improvement is often noticeable in function before it becomes dramatic on paper. And while you are doing that experiment, notice the meal composition. Did you feel worse after sugary breakfasts? Worse after restaurant lunches? Worse after salty dinners? Worse when you had wine? Worse when you barely drank water all day? Because once you pair the walk with awareness, you stop treating your body like a mystery. You begin seeing cause and effect. And awareness changes behavior in a way lectures do not. It is one thing for me to tell you that oversized carb-heavy meals can destabilize you. It is another thing for you to watch yourself feel awful after one kind of lunch and noticeably better after another. That is when change stops being punishment
and starts becoming common sense. There is also a psychological benefit here that people rarely talk about. When seniors start feeling bad after meals, they often become afraid of the period after meals. They dread the crash. They avoid plans. They stop trusting their body. And that fear creates another layer of stress, which can worsen symptoms further. But a small ritual can restore confidence. Finish the meal. Pause. Stand. Walk. Breathe. Return. That sequence tells your body and your brain, I know what to do here. And confidence is not fluff. When you feel less trapped by your symptoms, you move more, you isolate less, and your health often improves from that alone. Because fear makes people sedentary long before disease technically does. Now, I want to make one important distinction. If you have severe symptoms after meals, or you have been diagnosed with certain medical conditions that complicate movement, do not turn this video into a dare. Use judgment and use medical guidance. Some people may need a modified plan. Some may need blood pressure review. Some may need evaluation for postprandial hypotension, medication side effects, anemia, dehydration, arrhythmias, diabetes issues, or other causes. The reason I am saying that is because I do not want you blaming yourself if a walk alone does not solve everything. Habits matter tremendously, yes, but sometimes habits reveal a deeper problem that deserves proper care. And that is a win too, because at least now you know to look. And for the person who says, Doctor, I already walk, so this can't be the issue. Let me gently push back. The issue may not be whether you walk, it may be when you walk, how you walk, what you eat, how much you eat, what time you take medication, how hydrated you are, and what your blood pressure actually does after meals. Because healthy people often think in big categories. I exercise. I eat okay. I take my medicine. But blood pressure lives in the details. The body responds to specifics. Your timing matters. Your pattern matters. Your consistency matters. And the senior body is less forgiving of sloppy patterns than the younger body. That is not punishment. That is physiology asking for respect. If I had to boil this whole video down to one sentence, it would be this. Do not go passive in the exact window when your blood pressure may be struggling most. That is the trap. That is the hidden truth. After meals, many seniors unintentionally do the worst possible combination for unstable circulation. Big meal, chair, stillness, sleepiness, denial, and then they wonder why their energy is disappearing and their confidence is shrinking. A short, gentle walk breaks that chain. Not perfectly, not magically, but meaningfully. So the next time you finish eating, I do not want you asking only, was that meal healthy? I want you asking the better question. What is my blood pressure about to do now? Because that question leads to action. It leads to observation. It leads to safer choices. And for many of you, it should lead to standing up and taking that simple walk before the slump takes over. Not because walking is trendy. I want you to picture two futures. In one future, you keep brushing off the after-meal crash. You say you're just getting older. You sit longer, you move less, your afternoons get smaller, your confidence gets smaller, your world gets smaller, until one day, something happens that forces attention. In the other future, you start noticing the pattern now. You use the meal as a cue. You move gently on purpose. You adjust portions. You hydrate better. You talk to your doctor if the pattern is concerning. And your body slowly begins to trust you back. That second future is not fantasy. It is built from tiny decisions that look unimpressive in the moment and powerful in hindsight. So here is your takeaway. If you are a senior or you love one, stop treating after meals like dead time. That window matters. And if something feels off, take it seriously, because the final payoff is not just a better reading. The final payoff is staying upright, clear-headed, capable, and in charge of your life longer, which is exactly what we all want.